Hello, hello, hello. Good evening, good afternoon, good morning, wherever you are. If you can hear me, can you please send, indicate something. Indicate something for me to know you can hear me. A like, a comment. Let me know if you can hear me clearly. I can see 2 people have joined so far. Let me know if you can hear me. Hello. This is the farm edition. So it's a Sunday afternoon, and usually Sunday afternoons after church we pass by the farm, to see what is going on here. So this is the farm edition of Smart Nursing. We don't only do nursing, we farm as well. So we are in the farm today, and today I just wanted to debunk some myths that we have about nursing. There are some myths that just won't go away. You've heard it all from the inception of nursing, from Adam. They've kept saying things about nursing that just won't go away. And so today, hello, Wanda. All right. Thank you. Thank you for indication. Thank you for coming. So today we just want to debunk those myths. Okay, so many things have been said about nursing. You've heard the stories, you've heard the rumors, and so do you think that you really know what nurses do? I mean, think again. So without wasting my time, let's just get right into it. What do they say? Myth number 1, they say that nurses are just doctor's assistant. They just take orders. Nurses just take orders. Okay, that is what they usually say. But is that true? Nurses just take vitals. They just do what they are being told. But is that true? That is absolutely false. There is nothing true about that. Let me tell you, nurses do complex documentations, what we call care plans. Nurses are with the patients 24/7. They take care of critical conditions. They save lives. They actually intervene in situations before even a prescriber or a doctor approaches. Before a nurse will even call in a doctor, that nurse has already assessed the situation, seen what is to be done, seen what needs to be done, and then when a prescriber is coming in, the nurse is actually suggesting to the prescriber what he or she should come and do. So we don't just take orders, okay? We are nobody's assistants. We don't work for anybody. We are a team of professionals on our own that have a job description, okay? We do assessment, we intervene, and then we invite our colleagues who are also part of the team. It's a teamwork. You can never do it all. And so healthcare is all inclusive. It involves everybody, and everybody has a role to play. Nobody is the assistant or boss of the other. Okay, so if you are a nursing student, or you're somebody who has been hearing about it, or someone who has who is in the profession already, I think you already know this. But if you're a student and you're about to go for nursing, please know that nursing is not just what they think it is. Okay, it involves a lot of critical thinking. You need to think on your feet, make a decision. Then you invite whoever you think will be able to carry out that decision or that clinical intervention that you have identified. You invite the person that will take it or do it well. So we don't just take orders. Not at all. We are nobody's assistant. Nurses are professionals in their own right. All right. That being said, how about the second one? I mean, some of the myths might even shock you. Some of them will shock you. Okay. What else have they been saying? That anybody at all can do nursing? Anybody at all can do it. It is just common sense. Like, seriously? I can do it. It's nothing. Is it not medications they give? They just tie the BP cuff. They just, even about the vitals and just taking doctors, just heeding to what the doctor says, or just taking doctor's advice. Yes, we tie BP cuff, yes. We check vitals. We put the thermometers in the armpits, in the mouth, in the anus. We point it at them if it's a gun. Yes, we do that. But does it end there? It doesn't. It doesn't. Nurses interpret whatever they have taken. Nurses are able to take vital signs, interpret them, intervene, take or record ECGs, interpret them, intervene. So it doesn't end there. And back to the second one, it is not common sense. Oh, it is not common sense. Nursing is not common sense. I beg. Can I sound it so loud? Can I sound it louder? What else do I need to sound it? It is not common sense. Oh, nursing is hard work. Complex ideas, complex concepts broken down into pieces. Let me tell you, even the least certificate or the least qualification we have in nursing right now is 2 years. The associate diploma, or what we call certificate, is just for 2 years. But that 2 years, my brothers and sisters, the grilling that you go through, the classes, the lectures, the practicals, the OSCEs, the exams, it is not easy. The licensure is such that you don't start work until you pass. And people write that severally. Why? Because the system wants to refine the nurses. They want to churn out or bring out, nurses who are already prepared for the job. So they make sure they grill you proper. How can that be common sense? Where are we putting the anatomy and the physiology? Where are we putting the medicine, the surgery, the psychology, the microbiology, the pathology? Where are we putting them? That is no common sense. People have done diploma. People have done first degree. And so if you're going for the straight diploma, that is for 3 solid years. If you're going for the first degree, it is for 4 good years. Now, if you've done diploma already and you want to do first degree, then you're going to do additional 2, which will be 5. After that, people have done masters, people have done MPhil, people have gone ahead to do what we call PhD, okay, in the teaching field, and people have done doctors in nursing practice. So please, it is not common sense. If you've ever visited a hospital and you see a nurse doing something and you think that maybe, well, this was how he tied it, so I can also do it at home. No. It comes with a lot of practice and a lot of skills that you only get when you're trained in the school. It's a professional. It's a noble profession. It's not common sense. Nobody, not anybody can tell. Not anybody. You can't just get up and say, I can do what nurses do. Please. So that is an absolute false. That myth that is just common sense and everybody can do it. It is not. Even go online, ask around, find out the criteria or the pass marks or the cutoff grades that nursing institutions are demanding right now. Let us just find out what the nursing schools are even demanding right now. What grades you should have. Do you think it's a child's play? It's not. And nursing has long gone. Hello, Debbie. Hello, Debbie. You're welcome. Okay. So nursing is not like, well, maybe it's a last choice, it's a final choice, and I didn't get what this grade or that grade. Maybe some of them will say, well, I wanted to do medicine, I wanted to do engineering, I wanted to do what and what not, and I didn't get it. And so I want to do nursing. Please think again. I actually want to apologize for the background noise. Like I said, I'm in the farm, and you might hear cocks, crowing, chicks shouting, or even machines making noise. That's because I'm in the farm. You really have to forgive me for that, okay? But that's being aside, we'll try our best to do what we can. All right. So let's move on to the third one. What else have they been saying? So far, we've been talking about nurses, and we've been talking about the fact that there are some myths that people actually have about nurses that are not true. The first one was that we just follow doctors' orders, which is an absolute false. I don't even know how anybody can think that. We just follow doctors' orders, okay? We work together. We work hand in hand with the doctors. We jaw to come to an agreement. We discuss patients' conditions. We deliberate on ideas. We bring, each other's professional ideas on board to, save a patient. We don't just listen to doctors. So that's, yes, it's false and it's not true. And then the second one is that it's just common sense that anybody can do it. That is also absolutely false. All right. So let's move on to the third one. What else have they been saying? Well, nursing is only for females. The nurses are only females. And so, hi, Georgina, you're welcome. So it means that you go to hospitals, and then because of that mentality that nursing is only for females, you will see the patients or the relatives calling the male nurses doctors because they think that men cannot be nurses, okay? And there is only women who are nurses. But that is wrong. Maybe that can be true some time ago when nursing was started, when Nightingale actually started nursing. It was actually just Nightingale and then some females. Okay, there were no males then. But now the narrative has changed. I have a lot of fantastic male nurses I work with in my unit and in my hospital. All the schools I've attended so far, I have a lot of male nurses in my class, in my groups. They are everywhere, and they're actually very, very good. Look, some male nurses, some patients come in, they prefer male nurses. Well, this one I don't know because they think that they actually care than we the females. Well, that is a debate for another day. But there are lots of male nurses in the system, so I don't know why anybody will say today that nursing is for female. That's not wrong. Please allow your children to go and do nursing if they really want to. If they are boys and they really want to, you love the profession, and because nursing is actually a calling, okay? It's a passion. If you don't have the passion for it, you will find it difficult. because it comes with a lot of emotional roller coaster. It comes with a lot of hard work, a lot of stress. Sometimes you have to stand on the job for hours without even going for break. That is when all this burnout and thing comes from, because you're working, there are no break, and there is no way you will see work standing there and you want to get up. You will feel so uncomfortable. Okay, so long as the person is interested and says that, well, apart from all these things, I still want to do nursing, allow the person. Because let me tell you, there is no joy. There is nothing compared to the joy you feel when you actually nurse a patient and the patient comes back to his or her, usual or normal self. You know how the person was before the person took ill. It's so comforting. There is nothing so, I don't know, ask any nurse, especially when a patient comes in a state that is so, what is even the word? And then by the grace of God, you guys were able to bring the patient back. Oh my God. Oh my God. There is nothing compared to that feeling. Okay, so if somebody wants to do nursing and is a guy, allow the person. There are so many nurses. There are so many what is it called, male nurses out there. Hello, Georgina. You're welcome. Hello. Hi, Ola Jumoke. I love your name so much. Hello, Ola. You're welcome. Thank you so much for joining. Yes, Georgina. So if I get you right, you're actually asking what the theme is. Yes. So we're actually talking about some myths about nursing. Okay, some myths that people have said or been saying about nurses that are not really true. There is this thing about stories. There is this thing about, what will I say it? Things that go viral. Okay, even if it's not true, the more people talk about it, the more people say it, makes it look through, even though it's not true. Okay, it might be wrong, but because a lot of people are saying it, it turns out to be right. It's just like how the society will take something that is so wrong and normalize it. Like, this is the order of the day, and even though it's against our morals as a society or our culture or whatever, but because everybody is doing it, it's like the order of the day, and so it is true. Okay, that is something similar to what people have been saying about nurses. And so today, I just decided to talk about it and let's debunk them. They are not true. So far, we've talked about the fact that people say that nurses are just doctors' assistants. They just follow orders. They just carry. Okay, they just do whatever the doctor says. Okay, check this person vitals, then they'll go and do it. Check this, give this medication, and they'll go and do it. It is not true. It is not like that. Okay, there are instances where a prescriber will even prescribe something, and the nurse will realize that this is not supposed to be so. And even in that state, we have a conversation, we talk about it, and then we come to an agreement. That is why we are there. We are not just there to follow orders. Okay, and then the second one is that nursing is just common sense and everybody can do it. If I can tie the BP cuff on somebody and it rates, because now they have a lot of automated ones. There are even apps now that you don't even have to tie a cuff. You just, put your thumb somewhere and it gives you your blood sugar and all that, and so I can do it. It is not like that. It is not like that. Nursing comes with a lot of training and a lot of skills, a lot of hard work. You need to know why you are doing what at what time. All right, sorry. And the third one is that it's just a female job. That one. I don't even know what people say that to. I don't even know why people say that. Hi, Ola. I'm very well, thank you. Thank you for asking. I hope you're doing well too. So let's move on to, I think that will take us to the fourth one. And they'll be saying that, yes, nursing, if you do nursing, you are stuck, or you are just there, you can't progress, you can't specialize, you can't go anywhere. Please, please, let us not listen to all that. If you know anybody who wants to do nursing, encourage the person. Aside the gratification or the comfort you get to be able to save somebody's life or nurse somebody, you can specialize in so many fields. So many to choose from that sometimes you even get confused. So many. Well, yours truly, I have specialized in emergency. Okay, at the Ghana College of Nurses and Midwives. There are nurses I know who have specialized in oncology. Some are specialized in pediatric nursing. Some have done advanced midwifery, or what we call, yes, advanced midwifery, well women care. There's hematology, there's oncology, urology, name it, nephrology. There is ophthalmic nursing. There's otolaryngology, or what we call eye, ear, nose, and throat. So many. You can't even choose. There's perioperative nursing. There's addiction. What do you want? So many fields. Okay, so many fields. That is even if you want to remain in the clinical. So if you want to remain in the clinical field, you can specialize in any of these areas. Okay, you can even go ahead and do what we call DMP. There are doctors in nursing practice. There are doctors. Hello, Georgina. I am unable to understand. Can you please make me understand what you want me to clarify? I don't know if you're asking for the difference about something. If you can help me understand so I clarify, that would be very great. Thank you. So again, I must apologize for my background. I know that there are some noises behind me. Just bear with me. Okay. So you can specialize in any field. So please, if you know someone who wants to do nursing, encourage the person. Okay. We have doctors in nursing practice, or what we call DMPs. We have clinical nurse specialists. Okay. So it depends on your country or where you find yourself. So in my country, for example, Ghana, in the clinical field, we have the nurse specialists that are sort of the highest form of education. It doesn't end there though. So you have nurse specialists, people who have gone to the college, the Ghana College of Nurses and Midwives, and specialize in one field or the other. And then we have, and they are like members of the college. Then we have fellows of that college. So those who have done the nurse specialty go back, do 2 years and become fellows. Then you become a senior specialist. Okay. Then after that, you need to apply for the how do you call them, consultants. So we have nurses to even the level of a consultant. You don't only have doctors who are consultants. Okay. So you can have a nurse specialist who becomes a senior nurse specialist and then becomes a consultant in nursing. Okay, nursing is not just a one-time thing that you just go and do a degree or a diploma and then you are there. Okay, it doesn't work like that. There are so many opportunities. So you just don't sit. You can always specialize. So I know, for example, in the US, we have nurse practitioners. Okay, the nurse practitioners are like the clinical nurse specialists we have in Ghana. But then, mind you, the requirements and the criteria sometimes for these things are different. Okay, so it doesn't mean that if you're a nurse specialist in Ghana, you can work elsewhere as a nurse specialist. No, I am just telling you where you can reach. Okay, I'm just telling you the highest you can go, depending on where you find yourself. So in the US, we have nurse practitioners and we have doctor nurse practitioners. Okay, they are nurses, but they've done doctors in the nurse practitioner aspect. So you can have family nurse practitioner. Okay, that nurse practitioner also has other specialties that you can go into. Okay, you can have a family nurse practitioner who actually works as a prescriber, who works as a certified prescriber, and that family practitioner can work anywhere. You can be in the ER. Sometimes you're assigned to schools, sometimes in clinics somewhere. Okay, just like in my country, Ghana, here we have also nurse practitioners who also are prescribers, and then we have the nurse specialists who are also prescribers. Okay, then you can also go ahead and do your doctor in nursing practice. So if you do your doctor in nursing practice, you are addressed as a DMP. So there's a doctor. So for example, if I happen to do DMP in the US someday, I'll be called Dr. Evelyn Degwe, but the preface will not be PhD, it will be DMP. Okay, it will not be a DR. Usually in medicine, they like using in Ghana, they will write the BSc first and then they write MFC or MCE, sorry, which means that you've done your basic and then you've added 2 years to make it 6 and become a doctor. Or they will write DR. Okay, the DMPs are actually written DNP, like that. Okay, they're actually written as DMP. Hello. my bosses are here and I'm shy. Mr. Titus, you're welcome. Okay, so you can have yeah, so they write your name and then they put DMP in what do you call it, in bracket. So please, the nursing is not, you don't stop at one place. It's not, you don't hang yourself, and you've not hang yourself when you apply for nursing or you've decided to do nursing. It is not a death penalty. So many opportunities. Are you even talking about career opportunities? Are you talking about, I mean, what? Everywhere. Everybody is looking for nurses now. If you work in your country for a while and you think that maybe you want to experience, there are so many opportunities. Okay, just go online, find out where nurses are needed. Check and see if you fit into the criteria. If there's something you need to do for you to, fit into it and be called, you apply. You see, why not? So it is not just about nursing. You do nursing and you have nowhere to go, or you can't specialize in anything and you remain. No, that is absolutely not true. So far we've been saying that all these myths that they've been saying about us, they are not true. Number one, that we follow doctors is not true. That we just listen and take orders is not true. Number two, there is common sense. What at all do nurses do? We can all do it. It's a lie, oh. It's a lie. Nurses stand on their feet. Let me tell you, in emergency, triage is actually a nurse-led initiative. Nurses led triage. Triage is the most critical aspect of emergency. That is when you sort out the patients to determine whether somebody will die in 2 minutes and some will die in 5 minutes. So let me attend to. For you to be able to identify and choose who needs to be attended to first, that it takes a lot of critical thinking, a lot of reasoning, a lot of calculus. Okay, so it's not common sense. It's a lot of emotional roller coaster and critical thinking, empathy, all embodied in one. All right, so it's not common sense. Okay, and also that you cannot specialize as doctors, that is not also true. We know that, like I said earlier, there are so many areas that you can specialize in. You can go anywhere. Just know what you want and know what to go for. Because if you want to go, I think I said this in a video I made earlier, know what to do. If you've done your basic nursing, you've done your diploma, or you've done your first degree, and you want to progress, know the path you are taking. Okay, if you want to go the clinical way, then you have to go the path of the clinical career pathway that is there in your country. It differs in every country. In my country, if you want to remain in the clinical field, then you're going to specialize in any of the specialties I mentioned about some minutes ago. Okay, then you're going to specialize. And then if you want to remain in the teaching field, or you want to, you know, go the educational way, then you are not doing you're not doing MSc, you're doing an MPhil. That is what will actually ground you in the education field in my country. Okay, then from there you can do your PhD, you can become professors. In fact, there are nurses who are professors in this my country. Okay, there are nurses who are deans of universities in my country. So please, nursing is not a small. You don't joke with nurses. So there are nurses who are lawyers, and there are nurses who are politicians. Yeah, so what are you saying? You don't lock yourself when you do nursing. All right. So that is that. So what else have they been saying? What else have they been saying? If anybody has an idea they want to share, you can just type, and let's see. I think I wrote something down here. Let me quickly see what I wrote here. There is this myth that I just can't seem to understand. Okay. There is this myth that I just can't seem to understand. Okay. I think I might have mentioned that. It's about the vitals thing, that we just check vitals. Yeah, and we just, so that goes to say that if you know somebody who wants to be a nurse, or somebody who is a student already, please, we need to let them understand, okay, the dimensions of the profession that you are coming into. You need to know what it entails. It is not just about the beautiful uniform and then the salary that you might debate, okay, or just the bragging rights that I'm a nurse. No, there's a lot that goes into nursing. Before you even approach a patient, okay, if you come, you're a nurse, you're work, and then you're giving a patient, or you're approaching a patient, there are so many things that you will do. You are going to educate that patient. Sometimes we serve as advocates for the patient. You're going to explain procedures. You're going to talk about their disease condition with this patient. So before you even approach your patient, you should know why you are going there. Know your patients by their name. Know what condition the patient has. If the patient has any chronic condition, you should know. If that chronic condition is not why the patient is coming here, and is an acute problem that has brought the patient to the hospital that day, you need to know all the history, the past surgical history of the patient. You need to know. Why do you need to know that? It will help you, have a well thought through plan. Aside your care plan that you do for your patients with the acute symptoms and the acute problems that the patient has brought to the hospital, you need to know what is going on at home, what has happened before, so that in your discharge planning, you start thinking about all these things to apply. If the patient has an allergy and you don't know, maybe the patient is allergic to latex, you don't know, and you're wearing your gloves and you're going to attend to your patient, what is going to happen? The patient doesn't think of particular medications, and then it has been prescribed. And because you don't know, you go ahead and serve. So you need to know everything about your patient. You need to know their love values. Okay? You need to know the baseline vitals. Very, 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 very important. When the patient came to the hospital and your vitals were taken, what was it? It is not just for fun. That's why I said that. Those people who think that we just check vitals and we just write it and it's normal and everybody can do it, and if that is the case, it's common sense, are completely wrong. Okay, because there are reasons why you check your vitals, the time you do. There are reasons why we do it. If you've noticed, we don't always check everybody's vitals at the same time. Yes, there's a routine one. There's a routine one that you can check like every 4 hours, but there are some particular patients that you tailor it according to their needs. You can be checking vitals for somebody every 15 minutes. You can check every 5 minutes. You can check every 20 minutes. Well, if you're lucky and you have a monitor, then you set your monitor according to how you want your patient to be monitored. Okay. So it is not just about taking vitals.
Mommy, we are feeling the yam.
Okay. So like I said, apologies once again. Okay. So yes, we do a lot. We do a lot. Okay. I tell you, there are some remote areas that there are no doctors. I remember when we were in nursing training, we had a book titled Where There Is No Doctor. Eh, where there is no doctor. And the nurse becomes everything. I mean, this is Africa. I don't know if my colleagues from the other, what do you call it, African countries can share the same or similar experience. But I'm telling you that in my country here, Ghana, there are some places where there are no doctors and very remote areas, and then the nurse is everything. The nurse is everything. Okay, and there are midwives who are killing themselves every day. Some decisions that if they are not able to take will cause havoc, but they do that every day. They do that every day. So nursing is just not about common sense. Okay, a lot goes into nursing. Okay, but I'm also here to encourage my colleague nurses that do the good work that you are doing. Continue doing the good work that you're doing. Somebody somewhere is watching. Okay, somebody somewhere is watching. I am sure that the world has also seen what nurses are doing. In fact, nursing is one of the most respected professions in the country. One of the most respected, if not the most, one of the most respected professions in the country. All right. So thank you all very much for the good work that you are doing, and let's encourage others to come in the nursing field. We need a lot. We need a lot of people. Okay, we need a lot of people. The stress is real. We need a lot of people. If we can have a nurse to a patient, it will be very great. And then the quality of work will improve. Okay, and then we don't get tired too much. We don't. And when you check nurses who have retired, most of them have a lot of issues with their back, with their health, because on so many occasions they have to play, so many roles, dividing themselves into one person. You are the cleaner, you are the patient relative, you Thank you, Georgina. Thank you. You are everything for the patient, okay? And it kills you, it drains you. So before you even retire, you start feeling a lot of problems here and there. Okay, your health, usually they go on retirement and they are not able to enjoy their retirement because of the stress. I mean, it's very interesting that because you are still in practice, most of the times you don't really feel that, or you don't really feel the tiredness. I don't know how to put it. When you're home and you're not doing anything, it is then that you realize that, oh, so I have really been worrying myself for all these years. That is when all the stress gets to you and you're now tired and you're feeling pain here. Today you feel it here, the next day you feel it here. Okay. So this this live basically today is just to debunk some of those rumors that they've been saying about nurses, all those myths that they've been saying. In fact, they are not true. And it's actually a very beautiful profession. Very beautiful. It's look, there are a lot of drama, yes. There's a lot of drama that comes with it, and you need to be emotionally intelligent to be able to handle them. You can be at the unit, your department, and then the patient relative comes and they talk to you anyhow. Sometimes you get physically abused, not only verbally and emotionally, but you actually get physically abused. Nurses have been slapped, nurses have been pushed, you know, nurses have been attacked, even outside work. You're on your way to the house and people attack you for no reason. But you see, it comes with a profession and you are expected to be professional about it. But human as you are, most of the time it gets to you. Sometimes you get back home and you wonder, okay, sometimes we actually appreciate our patients because we know what they are going through. If we really understand the concept of sick and sick role, you know that caregiver stress is look, caregivers go through a lot. Okay, not only patients, yeah, caregivers go through a lot. Is it about money? About emotions? Looking at your patient and the patient is not getting better. Okay. Or there are some medications or investigations they're supposed to do and they don't have money for it. They actually displace all the anger on nurses or health workers. They actually looking for somebody to blame. Okay. So they will do a lot of displacement on you. Look, they will come and insult you. Sometimes they forget that you also have family somewhere. Okay. But as professional as you are, you're supposed to remain calm, listen to it. At the end of the day, at the end of the day, all right, Gina, all right, you can actually. I'm actually in the Volta region. I'm in the Volta region. Don't worry, I will link up to you. Okay, I'm actually in the Volta region. It's good to have a Ghanaian in the house, right? Okay, so yes, we are expected to become and then just listen. At the end of the day, as part of calming the patient down and then helping them to settle, you need to actually thank the patient. Even upon all the abusive ways they say, you are expected to thank them, calm them down. Sometimes when you do that quietly, they actually open up. some of them will burst into tears. And so it's something that we've seen over and over. And so sometimes when you see them reacting in a way, you know where they are coming from, and then we try to meet them halfway. But sometimes it might not even get to the point. Sometimes it will be too late because it might have hit you or pushed you, or so when those things happen and you go back home, a lot of thoughts will be running on in your mind as a nurse. That's why I said it comes with a lot of emotional roller coaster. Okay, and I am not being biased here, or maybe because I'm a nurse, but then I'm not being biased. I'm just saying that because nurses spend a lot of time with the patients than the other health professionals. Mind you, everybody is important. Okay, it's a system that is just like the human being. Okay, it's not the head, the neck, or the arms that are most important. None can function without the other. We are all very, very, very important. Okay, but just that the nurses spend most times with the patients than the doctors. That is why most of these things, you know, get back to them. Okay, so that's why I said that if you are thinking about being a nurse, or you know somebody who wants to be a nurse, you should just prepare them for the journey, that this is how it is. Because there is zero tolerance for error. Zero. Zero, zero. The number that comes before one. And there is no other number before that number. Is zero. Mm? Before zero is nothing. After zero is one. There is zero tolerance for error in nursing or in health practice. So you need to prepare for the journey. You need to prepare and know that it is a lot of critical thinking. It's not easy. Okay, but because of the emotions that comes with it, sometimes you come and you see them smiling, laughing. Sometimes you need some music in the environment to actually calm you down. Okay, and sometimes you need to take in a deep breath before you can actually work. All right, so nursing is very beautiful. It's very fulfilling. You can't imagine sometimes some of the deaths that occur is so, I don't know. It gets to you. You're not expected to cry, but sometimes you just can't help it. You just have to let some tears flow. At the end of the day, you might not even get any help to psychologically calm you down, and all these things are are hard on us. Okay, I think I even left one out. Maybe this one doesn't. You don't hear it everywhere, but yeah, the sadnesses are very wicked though. They are very, very wicked. Eh? They are very wicked. Why? Because they think that maybe a patient has passed away, and you've moved on to another patient. You know, you've moved on to another patient so quickly. You're not feeling what they are feeling. But once again, apologies. Okay, apologies. I've apologized like 100 times already. My background noise and all that. Okay, so it's not like that. It is not like that. I'm telling you, a patient will pass away and you will be messed up from head to toe. But what can you do? You have to go on and nurse the others. What can you do? And unfortunately, it's not every system or every facility that allows for debriefing, where you can go and talk about how your what is it called, how your your day has been, or how your shift has been. It's not every system that allows that. Okay, so you carry all the burden to the house. You go, you take your bath, you sleep, talk to your pillow, or you talk to your God. I mean, it's It's a whole lot of work. We are not wicked, though. We are not wicked, and we just inject people anyhow. We when we are doing the thing, we don't. Oh, we are not wicked. Nurses are not wicked. We are as humans as you are. It's just that we have to work. Okay, that is why before we do something, we explain to you and let you know that I'm about to give you an injection. It might be painful, it might be uncomfortable. I have to do it for you to get better. So we are not wicked. Because we carry needles every day, we are not wicked. Eh? Because some said we are superhuman, we are witches. That is why we can live with dead bodies. No, some of these things when you hear them, they are so funny. Okay, so nursing is a very beautiful job. It's a very important necessity for life. Without nurses, I don't know what will happen. I remember some time ago, some strike happened. Nurses decided to do some show. it was it wasn't easy at all. An hour was a problem for our other colleagues. Or even a minute was a problem for our other colleagues. Okay. So this is it. Thank you very much for joining. But then, do you have a story to share? Have you heard of anything that they've said about nurses? Or you're a nurse yourself and you want to share you want to share something? You can just type, or you can thank you. Thank you. You can just type, or you can opt to be added, I think. Let me tell you. And yeah, I wanted to say something, but let me keep it to myself. Okay. Yes. So who wants to share something? Debbie is here. My boss is here. Mr. Titus, I can see you. Georgina is also still around. Wanda, yeah. So who wants to say something about? Yes, it's important to you need to like. Okay. Painful menstruation. Is there anything I can do to reduce the pain? So for for menstrual pain, you really need to be assessed to know what exactly is causing the pain. Okay, if it's actually from your menses or it's something else. So I will advise that you actually see any health practitioner one-on-one. Okay. But then I will tell you something on my experience though, because I don't really know the specifics of your situation. Okay, most of the times we advise people, or we give treatment regimen or management according to the patient. Okay, but sometimes what people do, okay, is that if it's just the pain that comes with the menstruation, if it's just the lower abdominal piece, if it's the cramps, and then everything has been ruled out. Okay, that is why I started by saying that for you to get the exact help or the right help that you need, then you need to go and see somebody one-on-one, where assessments can be done, proper history can be taken, and then a suggestion will be given, or a management or treatment pathway will be cleared for you. But most of the times, what some people do, if it's just menstrual pain, is that they are advised to. So before you do this, you need to know the number of days your cycle is. Okay, you need to know the number of days you have in your menstrual cycle. Maybe if you're the type who usually has it on the 28-day cycle, or maybe your 26, or yours is 30 days, then you calculate and you know when next you're expecting your menses. If you're having your menses today, you calculate and you know which day in the following month you will have your menses on. Then 3 days to that particular day, 3 days to that particular day, you see a prescriber. They'll prescribe pain medication for you. Okay, and you start taking those medications from that day before your menses come, because the thing with menstrual pain is actually cramps from the muscles. Okay, it's actually the muscles around there. In our pelvic region there are a lot of muscles there. Okay, they are those that causes your cramps. Okay, and also um maybe for the fact that the ovaries are ruptured, and so some small sore might be there. Okay, and then something foreign. Now, if your egg is released and is not fertilized, and then it has expired, it becomes foreign. Your menstrual, sorry, your womb, your linings, we call it the endometrium. Okay, inside your womb, the lining was prepared for fertilization to take, for your fertilized ovum to come and sleep there and become a baby and come out. But that didn't happen, and it's time for it to come out. Those are the things that come out with the egg that has not expired, and then the lining, the preparation, like the bed that was laid, those things are coming out. So the fact that it is wearing off, maybe there's some wound or sore there that is causing some pain. Aside that, the muscles that are actually pushing the blood out are contracting, and so will cause some pain. Then what they advise those people, if they find out that it's actually menstrual pain and not anything else, okay, anything else, and it's menstrual pain, you are advised to take pain medication, which is actually prescribed for you according to your needs. Medications are given per patient. Okay, they are not generalized. What works for you might not work for me. So depending on the assessment they do for you, they will give you that pain medication. The particular one can be an NSAID, it can be anything, and they give it to you. You take it 3 days to that day of your menses. I don't know if was it Debbie? Yes, I think it's Debbie. So you're advised to take it 3 days to the day of your menses. So you will need to know how to calculate your menstrual cycle so that you will know when next you are expecting it. Okay, so that 3 days to the day you are expecting your menses, you will get help. They will give you pain medication and you start taking it before then. The testimonials are that it works. Okay, the testimonials are that it does work, and then the pain subsides. Okay, so Debbie, I think you can, I don't know where you are, but you can talk to someone very close, a health practitioner very close to you. They will actually, yes, they will actually know what to do. I feel like it's okay. I have to just talk to my neighbor there. Okay. I don't know if I've been able to answer your question. Uh, oh my dear. I know, right? Some menstrual cramps can be very painful. I mean, people even go to the extent of vomiting, and you know, they just can't. So uncomfortable. They just can't do anything. Okay, and so sorry about that. Let's see if it helps. Okay, yeah. Any other any other um oh my goodness. Have you tried anything? Have you spoken to anybody, Debbie? Have you seen a doctor about it? Because you should you should, and I think based on the discussion they will know what exactly to do for you. Because if I mention any medication right now, it might not be the ideal for your situation. I'm just giving you an idea, or I'm just giving you what will I say, a regimen that people really do. And I mean, most of the times with menstrual cramps, it's just the pain medication, okay. But the particular one to give you will depend on where you are and your situation, because some medications are not for everybody. Okay, some people, for example, there are some medications, some pain medications we call NSAIDs, that we don't give to people that have ulcers, for example. Like you have an ulcer in your stomach, what we call the peptic ulcer. We don't give some particular medications to them. And some people might be allergic to some things. Okay. But that regimen or that practice of taking the medication like 3 days to your day of your menses actually helps. And I don't know if you so you need to know how to calculate it even to know. Okay, and it's not constant that it will come on a particular day every month. Okay, you need to start from, maybe you have your menses today, you start seeing blood today, then you mark today as day one. Let's say you don't know how many days your cycle is and you want to know, this is what you do. So you mark today as day one. Okay, then you keep counting until you see another blood, which is maybe in another month, and then you note the number of days in between those two. So today being your first blood, day one, then maybe on the 29th day you see another blood. For the first month, you note that down. Then you start counting from that day again. That 29th day, start counting, it becomes another day one. You count until the following month you see another. Maybe the interval in those two will be like 28 days. Note that down also. And then you you do for a third month. Maybe for the third month you calculated or you counted and then you had like 30 days. So now what you do is you take your 29, you add it to your 28 and add it to your 30. Then you divide by 3, you strike an average. Okay, so you need to monitor your menses consistently for at least 3 months, and then you strike an average, and that will become your possible most possible uh, menstrual cycle or cycle duration. Okay, let me take that again. So maybe you start seeing blood today. Note that day as 1. Then you keep counting and counting until you see another blood. Then that will become uh, so you see another blood, and then you take note of the interval between those two bloods. maybe it's 29, you write it down. Then start counting again from that month till you get to another month. Maybe you get 28 and you put it down. Then another month, 30 days or something. Then you add the 3 and then strike an average. Okay, and then that will become your most possible length for your circle. Okay, the thing is that irrespective of the number of days you have in your circle, the ovulation doesn't change for anybody. That is the most important anyway. It doesn't change for anybody. For the ovulation, it's on the 14th day, but you need to add plus or minus 2. Okay, so what that means is that if your menses start today, most likely on your 14th day, you might see another one. Sorry, you will see an egg being released. But you subtract 2 and add 2 to the 14. So it means that on the 12th, or on from the 12th through to the 16th day of your cycle, you will most likely release egg in any of those days, which is your dangerous period. And so if you're expecting pregnancy, that is when you need to be trying your unprotected sex there. But if you are not expecting pregnancy, then that is when you're supposed to be careful, okay, with what you do. All right. So if you are able to do this and then you find your circle length, then you can now start expecting or be anticipating. If you know that your circle is 28 or is 29 and you have your menses today, you know that in 29 days it will come. But that also you need to add plus or minus 2 to it. So from the 27th through to the 31st day. All right. On the 31st day, you might have see your menses. So before then, you can prepare the pad down by taking the prescribed pain medication that will help in the menstrual cramps. All right. Okay. Any other contribution? Any other suggestions? I actually would love to know what you've heard about nursing though. Well, what are some of the shocking things that you've heard? Or what are some of the interesting things that you've heard about nursing? I really would love to know. I really, really would love to know. What have you heard? What have they been saying about us? Maybe we need to know so that we can oh, it's funny, but it's not funny. Maybe we need to know so that we watch our back. As somebody say, you watch your back. Yeah. Hello. Okay. Okay. That will be it in the absence of any the absence of any suggestions, any comments, that will be it for today. Thank you very much. Thank you very much for joining our live. We hope to be, we hope we'll try to do this every week. We'll try, if not every 2 weeks or every once in a month. We'll try. We'll try to do this. And so, thank you for coming. Thank you very much for coming. And this is SmartNursing actually. You can subscribe to our channel. It's just SmartNursing with Nurse Heavy. And we intend to bring you this interesting aspect of nursing and also give you some nursing tutorials and give you some nursing tips as well. Okay. So this is a farm. It's a sneak peek. Actually sitting in the bamboo area. Okay. Okay. Let me see if I can give you I don't know, a small on the farm. Fortunately, it seems to be drizzling. It's beginning to drizzle. Okay. Beginning to drizzle and I'm hiding somewhere. But if you want to see the farm, you can let me know. So I give you a sneak peek. We actually have fowls. There's poultry. There's some maize. There's some beans, yam, and so if not, thank you very much for joining. And once again, I would like to apologize for the background, from the cocks that were calling, from the machines that you heard earlier. I sincerely apologize. Okay. So thank you for coming. Thank you for keeping us company. If there is nothing left to be said, then we'll see you another time. So like I said, we'll try and see if we can, I don't know, do this every week. It's hard to pick, right? I have to pick something right now, but it will be hard. Okay. So thank you for coming. We'll try do this maybe weekly, bi-weekly, or monthly. But if you haven't subscribed to our channel yet, please subscribe. It's Smart Nursing with Nurse Evie. We actually do nursing tutorials. Okay, we try to break down some complex nursing conditions or concepts or things that are difficult for nurses to understand. Okay. So subscribe to our channel, like and share, comment on our videos, and let's get going. I want to give you a sneak peek of somebody. I don't know if you can see the I don't know if you can see him, or maybe I should this way. Okay, thank you very much for coming, and we will see you again. I'll see you again another time. I'm so happy, so grateful for you joining it. Thank you. Do you have something to say though? They're asking how you're doing, Mr. Handsome.
Oh,
That's actually my husband. he's busy taking records in the farm.
we are fine. We are doing great. And in fact, we appreciate you for following us and subscribing to our channel, giving us comment and how to grow. We are grateful.
Okay. All right. So, thank you, Debbie. Thanks for the company and the participation. So, we have to go. Except you want to see the files that I can show them to you. Oh, thank you. Thank you. That's really good to see. Okay. Would you like to see the farm? I can show it to you briefly. It's actually a form. It's a therapy anyway. So we usually do this on weekends just to relax a bit. I can just show you. I can show them to you briefly. Okay. So let me see. All right. So I will do this. Yes. So this here is the yam mounds. The yams have just started sprouting because the rain has delayed a bit. So they just started. Okay. There are some waste inside, so you can see this is yam. This is yam coming up. So all this area is yam with some weeds inside. Yeah, I know, right? Fresh air is really, really needed. And so some plantain. These ones have just been planted, so they haven't really, started producing fruits yet. Then we have maize over there behind that other plantain. There is maize somewhere there. I don't know if you can see maize. Then I'm going to the fowls. That's the main thing here. The fowls are here. Yeah. So these are fowls. They are there. the layers. Oh, one of the fowls just picked up my leg. Okay, so let me hide and show you. So, yeah, so if you can see, this is one of the, and then we have another over here. Oh, okay, this is the other poultry. They are also layers. Okay, I think I'll take you back to the okay. Yes, maybe the yam is so because it hasn't really started. It hasn't really started sprouting, so it's difficult to. So this is one. This is one. Okay. Yeah. Okay. So thank you very much for joining. Thank you for your time. Thank you very much. Okay. And we will see you another time. Okay. Bye.